Welcome back. We have Manshadi joining us from Manshadi Pharmacy on this Wednesday afternoon. Welcome back to the show.
Thank you for having me again. How are you, Susan?
I'm well. I'm a little worried about the sound of the wind outside. It's quite strong, isn't it?
Yeah.
Yes. Yeah. Merry Christmas, first of all.
Merry Christmas to you and your staff.
Thank you very much. I know that you and I are going to talk a little bit about some of the topics that we've gone through over the course of the 2016 calendar year.
Yes, that's
We have a
correct.
chart, so why don't we hit that and take a look at the things we've covered. Some of these very timely in regard to what's going on in our society. Would you like to start with the first one?
Sure. Smoking cessation. So the law in British Columbia is changed. You can actually, doesn't matter how much money you make or you don't make, you can go for nicotine replacement therapy to any pharmacy and they give it to you for 3 months, the lozenges, gum, patch, or puffer.
No prescription, no questions asked?
No prescription, no question asked. Talk to the pharmacist and they will help you out.
That's amazing.
That's a great thing for British Columbia. I don't know anywhere in Canada it's been done, but they are doing it in British Columbia, which is awesome.
Yeah, it is. And you were mentioning smoking takes on the average 14 years off of a person's life.
You got it.
14 years.
That's quite a bit.
If you're lucky, it could be more, right?
Yes,
so if you're
correct.
lucky, I would say 14. Back to the board we go. The second one up is signs and symptoms of heart attack and stroke.
Okay, Susan, by the way, do you remember the signs of stroke? What would be the sign of stroke?
Well, you and I talked about it, and it's the acronym is FAST. So F-A-S-T, face, arms, speech, and can't remember, time. Time is crucial.
Correct. So face is drooping, arms is both arms are working, and S is for speech is slurred, and T is time. A lot of people get disabled or they don't make it. If we know the signs of stroke,
yes,
obviously the faster we get to the hospital, the sooner we can get help.
Okay.
And the signs and symptoms of the heart attack, you are looking at perhaps chest discomfort, upper area discomfort, nausea, breathing, different kind of breathing, sweating, sometimes even heartburn. So familiarize yourself with the signs and symptoms of a stroke and a heart attack.
The next one up is signs and symptoms of diabetes. Diabetes, of course, is a massive modern-day epidemic in our society.
Correct. Again, this is one of those areas that if we don't control diabetes, it actually can cause huge complications. So we need to understand again the signs of high blood sugar or hyperglycemia. So that would be again increased thirst, increased urination, increase in appetite, for example, nausea, vomiting, fainting, change in weight. Those are some of the symptoms of high blood sugar, especially during this time of the year. Maybe if some people indulge too much and have those signs and symptoms, we need to get them right away to the doctor.
Okay. Prevention of drug overdoses. Obviously, this is a massive one for the 2016 calendar year. Just a huge situation in our province.
Absolutely. So familiarize yourself with downers. Downers are the drugs that are causing the overdoses, opiates, fentanyl, morphine, and so forth. Remember, the naloxone is available in the pharmacies without a prescription. You can get 3 vials of naloxone with the other equipments that goes with it, around $45, which can save lives. So that's something to remember. For further information, you can go to any pharmacy and talk to them.
Back to the board. We still have a few more points, but only 2 minutes. So maybe we'll just choose 2 of these to talk about. Which 2 would you like?
You choose it.
Well, of course, sun protection, massive changes in pharmacare. That's a big one.
That is a big one. So there is changes in pharmacare in December came into effect. Some people that they are taking high blood pressure or pills or heart disease pills or cholesterol pills or antacid pills, their coverage is changing. So you need to reach out to your pharmacist and find out the drug you're taking, it falls in that category because there is a change in the coverage. So we need to reach out to our pharmacist to find out if you are basically affected by it.
Okay. Back to the board, the last one. I think more and more people are becoming quite savvy about using antibiotics responsibly. Flu versus cold is obviously a big one as well. And then maybe we'll focus lastly on number 7, new physician guidelines for prescribing opiates, stimulants, and sedatives.
Correct. In 2016, now the guidelines are changed for prescribing those medications. So you can't go automatically to your physician and ask for those medication. There is much more involved, and there is guidelines that the physicians have to follow to prescribe those medication to the public.
Okay. Lots of things people need to be aware of, and these changes come every year, right? It just depends on what the needs are of the day. I would like to take this opportunity to say thank you, Misa, for being here every month to talk to us a little bit about some of the medical things.
It's a pleasure. Every little thing will help, and it might save lives too.
All right. Well, you have a wonderful season. We will look forward to seeing you back here in 2017.
Me too.
Awesome. Okay, quick break. When we come back, we're going to tell you everything you need to know about Kibit coming up at the end of the month. Stay with us.